Hello, I'm Carol Celine, talking with thoracic surgeon Dr. Scott Cowan. Now, Dr. Cowan, you operate essentially in the area of the chest. Do all of your patients have cancer?
They don't. I'd say about 80% of the cases that I do are related to lung cancer, but there are other conditions in the chest, such as thymic masses, such as thymomas. There are benign diseases, meaning processes that aren't cancer that we also operate on. These are due to infection, empyemas. For diagnosis, sometimes we'll do pleural biopsies and take care of patients who have effusions or fluid that reaccumulates between their chest wall and their lung.
A lot of things that can go wrong. What is new and hot and happening today in lung surgery?
I'd say minimally invasive surgery is the new procedures that are on the forefront.
So, describe what that is.
So typically, lung cancers were approached with thoracotomies, which are incisions that are relatively large, usually in your side, about right next to the affected lung. And frequently muscles are divided, pretty large muscles, and the chest is entered and the ribs are spread. And the lobe is taken out that way. What we've transitioned to in approximately 80% of cases here at Jefferson is a minimally invasive approach where we're making three very small incisions. The largest is approximately 3 to 4 centimeters. We're not spreading the ribs. We're actually going in between the rib spaces and resecting the whole lobe and removing it through one of those 3 small incisions.
So when you say resecting, you're still removing the lobe, but you're removing it in pieces?
We're doing the same operation, but we're doing it through 3 smaller incisions in the chest wall. It's important to do the same operation and to offer the patient the same surgery, but in doing this through a minimally invasive approach, through those 3 small incisions, we're able to decrease the amount of pain that the patient has.
So you're, as I said, you're removing the same amount, but you're doing it in smaller pieces?
No, the same amount comes out through that small incision.
Wow. So with all the lung cancers you remove, and I can imagine you must be a fierce advocate of non-smoking.
Absolutely, absolutely.
Are there other things that cause lung cancer, though?
There are. Secondhand smoke is a major cause of lung cancer. Radon has been shown to contribute to lung cancer. And there are genetic causes, which there are some patients who have never smoked, who have very little, if any, secondhand smoke exposure, who develop lung cancers. Genetic causes are definitely a factor.
But we don't know enough about them yet.
Correct.
Thanks for coming in today.
Thank you.